So for psychedelic session, we hear a lot set and setting is really important.
Yeah.
So could you explain about it? And also, especially the ketamine session in United States or other country, they use it as a without psychedelic therapy. What
Yeah.
is the difference of that? How could you explain about it?
Yeah. Well, Timothy Leary, who during the 60s really popularized LSD and other psychedelics, came up with that phrase, set and setting. And it really speaks to what set speaks to is what's going on with the individual, what's their intention, what are they bringing in terms of life experience to the psychedelic journey, what kinds of issues are they working on, what have they experienced in their life that they want to review and make sense of. So the set is the intention and what a person brings to the medicine journey. The setting is the environment around them that's holding that experience. That Naoko and I really strive to create a very safe environment, a very attentive environment where we're very present with your experience. The music is part of setting. The couch or the bed or the chairs that you sit in are part of the setting. The art is part of the setting. Your surroundings and what kind of environment you take the medicine within is described as setting. Ketamine is also offered IV. In fact, it's the most common way it's offered within the United States, and I think worldwide as well. And intravenous, so you're hooked up to an IV drip that goes into your vein. It's typically done without psychotherapy. So often people are sitting in a room with other IV clients, or they're sitting alone in a room without anybody sitting with them. The way that I do ketamine therapy is with psychotherapy. So there's somebody sitting present with you all the time. And that's because ketamine not only has an antidepressant effect, but it also has a psychedelic effect. And like mushrooms do. And people can go into a very psychedelic state on ketamine, and it's very reassuring to have somebody sitting right with you, to be able to hold your hand if you get scared, to be able to have a hand on a foot if you get scared, and to just listen to what kind of experience you're having, and to be writing it down as it's happening. And that information, sometimes people don't remember what they experienced, but while they're able to verbalize it and speak it, and to have the practitioner, the facilitator write it all down, then I usually type it up and give it back to the person so that they can reread it, and then we have something to talk about during the integration session. So there's a fairly big difference between ketamine-assisted psychotherapy, which is the way that I'm using ketamine, where somebody, if not two therapists, are present with you the entire time, monitoring for medical safety, taking blood pressure, taking oxygenation and pulse rate, really present in case anything comes up that we need to address. Medications are available if there is a need. So it's held within a very safe medical environment. And the psychological approach is also brought during the ketamine-assisted psychotherapy. IV ketamine is very different. It's being used primarily as a passive antidepressant. And it's very effective as well. 65-70% of people see an alleviation of their depression within 4 to 6 sessions. 30% might not respond to it. But that's a fairly high rate in terms of the way that antidepressants work. I think that when we add in the psychotherapy to it, we actually push it up to 80 or 85% of people being benefited, having their depression alleviated. So I think the psychotherapy is an important component of this. It is more time spent with professionals. It is a little bit more expensive, but I also think it's really worth it because of how it's held in terms of safety, in terms of the psychotherapy, in terms of those aspects. It's more beneficial in some ways.